All right, so you've probably been prescribed an antibiotic. You know, they're necessary to get rid of illnesses and to get better faster. And tonight's Wear the Gown, KENS 5 reporter Jeremy Baker finds out when not to use them and what could happen.
Resistant bacteria are the cause for more than 2 million infections and 23,000 deaths in the U.S. every year. That's why using antibiotics properly and only at the right times is an absolute must.
Antimicrobial resistance is what we say when we're talking generally about bacteria that develop a mechanism to make the antibiotics that are being used not effective.
Dr. Jason Bowling is an infectious disease specialist with University Health and a professor of infectious diseases with UT Health San Antonio. He says anybody who takes antibiotics is at risk for developing resistant bacteria.
We have bacteria that live on us and in us. We actually have more bacteria that live on us or in us than cells in the human body. Most of those don't cause any problems. When you take antibiotics, it impacts all of those bacteria, and each exposure they get to antibiotics increases the risk that they can develop resistance mechanisms.
The causes of antibiotic resistance include overuse and misuse of antibiotics, patient noncompliance with antibiotic courses, unnecessary antibiotics in agriculture, and poor hygiene, sanitation, and infection control practices. So when should they be used?
Antibiotics should be used only when the benefits outweigh the risks. And so that's when you know that you have a concern for an acute bacterial infection and the benefit of treating somebody is more than not treating them.
And when should they not be used to treat a virus?
Sometimes people think that they'll feel better faster, but antibacterials will not make you feel better if you have a common cold or other viral infections, which are usually more common.
For more information about antimicrobial resistance, we have the links with this story on KENS5.com. Jeremy Baker, KENS 5.